Kruger. It's an honour to serve under you, and I welcome the debate. I should declare I'm chair of the all-party parliamentary group on for dying well. May I start by saying how much I recognise the good faith and the integrity and the very powerful arguments made by the honourable member who initiated the debate, by all members who are speaking in support of the petition and by all the campaigners who have supported it as well. And I recognise the extreme distress and anxiety felt by people and their families who have been through the agonising death of a loved one, experiencing suffering that no human being should go through. And I want to address the issue of bad deaths in a moment. But first I want to look at the implications of assisted dying as I see it. What would happen if we did this in this country based on the experience of our own and other countries? And I don't have a suite of powerful personal stories, all of which I recognise the enormous moral value of. I invoke the nameless and numberless people who will be affected if we introduce this law. And the main argument for assisted dying is the simple one of autonomy. And I think a lot of the support for assisted dying comes from the simple and natural resentment that anybody should try and stop people doing what they want, especially about something as important as this, literally a matter of life and death. But in fact, in this case, things are the other way around for many people. We need to keep assisted dying illegal, in my view, because in practical fact, for many people, it would narrow their autonomy. It would reduce their freedom substantially because it would put them on a path that only has one destination. This is because of the incentives that assisted dying would introduce. First, the incentives in our healthcare system. And the simple, blunt fact is that it is cheaper for the system to help people to end their lives early than to care for them for weeks or months or years. And this isn't an argument you hear for assisted dying, but it's actually very compelling. And in fact, the cat was let out of the bag, rather, when the member of the Scottish Parliament, who was trying to legalise it in Scotland, cited research from Canada showing that the health service there has saved hundreds of millions of dollars on care costs. And in fact, we see, in contradiction to a point that the honourable member made, where assisted dying is introduced, investment in palliative care stalls, or in fact recedes, slows down in comparison with countries where it is illegal. And meanwhile, in Oregon, we see people being refused palliative care on costs grounds and then choosing assisted dying because there is no other option. And I know we don't, or we pretend we don't have rationing in the NHS, but we do. Obviously we do, with finite resources. And do we really imagine this won't become an option that doctors and medical managers won't tacitly, even unintentionally, encourage? And if members... Happy to give way.
Very good. He's making some very interesting points. I'm on the other side of the argument, I must say. But I think in this argument, such a controversial, issue we've got here, wouldn't it be sensible, we tend to point to facts on either side of the argument, wouldn't it be sensible to have an inquiry, an independent inquiry, Health Select Committee or other, to look at the points he raises and the other points others would raise on the other side of the argument?
Well, I recognise the force of that. The fact is Parliament has debated this topic repeatedly over the last 20 years. We've devoted considerable numbers of hours of parliamentary time to it already. Happy to give way.
I'm very grateful indeed to the honourable gentleman. In 2015, we did have the opportunity to vote on the matter, and that was a great many years ago, and many people here today in Parliament were not, in fact, present. Does the honourable gentleman agree that repeatedly is perhaps the wrong word perhaps to have used in that context?
Well, I mean, as I understand it, just in this Parliament alone, we've had 14 hours of parliamentary time devoted to this topic. I suggest there are other topics that we could address. And in fact, I'm going to come on. I recognise the point that this is worth discussing, but if you'll allow me, I think actually there's something we should do first before we consider this, which is the point I'm going to come to in a moment. I'm just going to proceed, if I may. So I think that I suggest that if members think we can prevent the people being put on the pathway to assisted dying by good drafting or because doctors are good people, which obviously they are, we should think about the do not resuscitate scandal we had in the pandemic. We should think about the Liverpool care pathway and then suggest there is no risk. I think there is. I know doctors are good people who want the best, but if we force them to make utilitarian decisions about the best use of resources, won't they push people in this direction? And so much for the pressure on the healthcare system to take this route. I worry even more about the pressure on patients themselves to request assisted dying if it's an option, because it will be an option for almost everybody approaching death. That is the proposal. Clinical guidelines for many terminal or chronic illnesses will likely require doctors to ask patients whether they would wish to have assistance in taking their own lives at an early stage of planning treatment. What a question to ask. But whatever the guidelines, every family will be required to have the conversation in whispers or quite openly. And in some families, we know how that conversation could all too likely go. Over half the people in other countries where assisted dying is legal choose it because they feel they are a burden to their families. Tragically, a lot also say that they are lonely. Isn't this terrible? People getting the state to help to kill them because they don't want to be a burden on a family that never visits them. Talk to any hospice manager about relatives and they will quietly confirm it. There are a lot of people who want granny or grandpa to hurry up and die. Happy to give way.
Thank you very much. I thank the honourable member for giving way, and he is making a number of points, and I am, like the other honourable member, on the other side. But is it not the case that many of these people who are being characterised as wanting granny or grandpa to hurry up and die are in fact simply wanting their pain to end and want a compassionate way to bring that to an end? Rather, they don't want them to die. Wanting them to die is the furthest thing from their mind. But they're going to have to die, and they want to make it a better death.
Thank you. I really do thank the honourable lady for that intervention. She's absolutely right. And thank you. I do thank her for allowing me to make abundantly clear what I hope I'd made clear earlier, that I recognise the enormous power of this campaign, and I recognise for how many people this is exactly what they want, for the best of intentions. The overwhelming majority, I'm sure, of the people who are campaigning for this, certainly all the people who are campaigning for this, and the overwhelming majority of people who would imagine that they would make use of this law, do it for the absolute best of intentions. And please, can we not have deliberate misunderstanding of points that I'm making? I represent a lot of people who think this way, and I'm making this point in all sincerity. And I do challenge members, many of whom must visit their hospices, and know what is acknowledged about the fact of elder abuse. We have a tragically rising epidemic of elder abuse in this country. Half of elderly people who are victims of financial crime are victimised by their own adult children. And it's not just the elderly we need to be concerned about. It is no surprise that no disabled organisation supports this proposal. It is the most vulnerable people, the people who by definition rely on the support of other people, their families and professionals. They are the people most at risk from assisted dying laws being misapplied, which I fear is what would happen. Suddenly, every controlling and coercive relative, every avaricious carer or neighbour, every overstretched or under-resourced doctor or hospital manager would have the means to cut their costs. And I don't believe it is possible to design out the risks.
I'm very grateful to my friend. I expect